Hello, my name is Natasha Tracy, and this is Breaking Bipolar for HealthyPlace.com. Today I wanted to talk a little bit about what it's like to see a new doctor. So today I have the unenviable task of having to meet someone new. If you've been following me for a while, then you know I've been having problems getting to see a doctor. Finally, I was referred to a doctor that I had previously seen, and he agreed to see me. However, he almost never takes on new patients because he has no time on his schedule to see me. So he has said that a resident will be seeing me part of the time, and he'll be seeing me part of the time, if that's okay. So I said, that's fine. So today I'm going to meet a resident. So a new doctor, a fresh doctor, someone who has not yet been indoctrinated with all that is mental illness. And it's an extraordinarily stressful experience. It's hard enough to deal with experienced doctors who have an idea of what mental illness looks like that's staring them in the face. And certainly new doctors are even more challenging. The faces of mental illness are many and varied, and so some doctors, particularly someone new, may not see what is in fact sitting in front of them. For example, I tend to present very well to doctors, I'm very communicative, I'm eloquent, I can say what I need, I can say what I want, I can say what's happening for me. And doctors often mistake this for actually doing well. This is understandable, as many patients come into their office completely broken down and out of touch with reality. I just don't present that way. It's just not me. However, that does not necessarily indicate that I'm not very ill. There's a very ill me that's going to go home and break down and very much need medical treatment, even if I don't appear that way at first glance. And so when I meet a doctor, I have to explain this to them. I have to explain that I'm a bit different, that how I present isn't really how I feel. I have to explain to them my background in mental illness and how much I understand about psychopharmacology and psychology. I have to explain to them about my own personal physiology and how I tend to react to medication. I have to explain to them all of the drugs that I've been on and watch their eyes go wide as they have no idea what to tell me next. And I have to field question after question from them. When was the last time you tried lithium? How much were you on? What happened? What were the side effects? Well, last time I was on lithium was about 2 years ago. I don't remember 2 years ago. I have no idea what happened. I know it sucked. I know it didn't work. But that's what medical records are for. And yet, somehow, doctors expect patients to remember this. Doctors expect me to remember all 40+ medications that I've been on and specifically what happened when I was on each medication. So, seeing a new doctor is difficult. It's about adjusting their expectations and my expectations as to what they can do for me. And as a result of this, I do tend to be very stressed before I see one. In fact, I generally have to bribe myself with the offer of a latte in order to get myself in the door. That being said, it is a requirement. Doctors must be seen and new doctors must be met from time to time. That's all for now. I'm Natasha Tracy, and this is Breaking Bipolar.